The healthcare system in the United States is generally an individualist one. We have to acquire health insurance and find a personal physician who will prescribe medication as needed for our physical ailments. If we're mentally stressed, we might see a therapist to learn coping skills or a psychiatrist who may prescribe an antidepressant. Our overall health is seen as disconnected from our environments and from one another. And addressing those external issues falls on us as individuals again to tackle, such as figuring out how to stretch our paychecks to cover necessities, as well as extras like fitness plans or vacations, and finding time for social activities, childcare, and so on. Well, a new movement based on an old idea is taking hold. What if, in addition to prescribing medication, doctors and others were able to prescribe activities that addressed our lack of connection? Writing about that is Julie Hotz, journalist and author of The Connection Cure, considered to be the US's first book exploring the science, the stories, and the spread of what's called social prescribing. Her work has appeared in the New York Times, Wired, Scientific American, Boston Globe, Time, and more, and she helps other journalists report on the big news ideas changing the world at the Solutions Journalism Network. Welcome to the program, Julie.
Thank you so much, Sonali. So great to be here.
So let's first talk about the science behind the connections and a little bit, in a way, sort of the human history, which you go into in your book. I want to make clear to our audiences that you're not suggesting that we don't need pharmaceuticals or medication. You know, if you have cancer or diabetes, social prescribing isn't going to help you survive. So what is the science of prescribing connection in terms of the historical framework of some of the historical figures that have done so, and then the science that has affirmed that indeed some of these historical figures who started this trend were on the right track?
That's a great point. Let's start off by saying absolutely, social prescribing is not about replacing pill prescribing, therapy, or anything else. We want this to be another option on the healthcare menu for treating some of the symptoms of illnesses that can be healed in our environments. So, what I mean by that is, if you think about it, we as humans didn't evolve to live quite like we do now. I wouldn't trade it, I wouldn't go back. But we evolved in communities. We evolved to move our bodies and spend time in nature and tell stories and make meaning with our neighbors. And there's some science suggesting that returning to doing those things, integrating those activities in our daily lives, can have tremendous mental and physical health benefits. So the book goes into details of each of these kind of 5 core ingredients: movement, nature, art, service, belonging. But in general, we've found that, for example, moving your body, is associated with increased serotonin, a hormone and neurotransmitter associated with energy, mood, sleep. We've found that spending time in nature is associated with increased attention and reductions in the stress hormone cortisol. We found that creating art is a powerful coping mechanism for anxiety. We found that feeling a sense of belonging with other people is incredibly effective for our health and longevity. In fact, a great book by Dr. Robert Waldinger says that human relationships, social relationships, is the #1 predictor of a long, healthy, happy life. So social prescribing is about reconnecting us to those life-giving virtues, whether it's through an art class or swimming lessons or a cycling group or even a simple community potluck. And the stories in this book talk about how patients can really be healed through them.
So this doesn't necessarily sound groundbreaking or new, right? In our social media, for example, there's all sorts of prescriptions, sort of ironic given that most of us get disconnected because we're paying too much attention to social media. But you've got your TikTok therapists and others who keep reminding us, our sort of wellness coaches, life coaches, often in the US especially, is a very American phenomenon, know that this is true, have helped people navigate individually. So why, how do you take the science that's already known, that's accepted, that's widely, seen as not controversial and intersect that with our healthcare system? And why is it the job of the healthcare system to address that?
That's right. We hear that a lot. Some people say, why does this book need to be written? Of course, we know that movement, art, and nature are good for us. I think there are a couple of reasons. Number one, social prescribing is about having healthcare actually be the sort of facilitator of this prescription, and then using the resources of healthcare to actually put the patient who's receiving this social prescription in a group that meets once a week to ride their bikes together, or is part of this nature course, or is part of this art class. In other words, whereas sometimes the solutions we read about on Instagram or otherwise have marketed to us are very much, you go and spend time in nature, you go and create some art. It kicks the burden back to the individual. But having a health worker actually prescribe us these things, number one, means probably the patient's more likely to take it seriously because they know that that health worker is going to check in on it. And number two, prescribing them to an actual group that does this is a form of accountability. In other words, a social prescription I love for myself is my running group here in Brooklyn. And I am following it because I know that they meet every Wednesday at this certain time. They'll be expecting me if I don't show up. So, social prescribing is a way to help us actually practice the things that we know to be true and good for our health. And your other question is a great one too. Why should healthcare be doing this, right? In an ideal world, it would be easy for us to know about what kind of activities and resources exist in our community and prescribe ourselves. I think social prescribing helps us get there in the meantime. It's a way to funnel the existing resources and mechanisms of how we do healthcare, right? When we don't feel well, we go to the doctor, to actually have that healthcare institution prescribe us something that goes beyond just individual solutions and actually reconnects us to our communities.
So where is this trend taking hold? We have a hard enough time here in the United States to get our health insurance companies to cover needed surgeries, say, or other procedures. And so that's a whole nother maybe aspect to our conversation that I hope we'll get to, which is that the U.S. healthcare system is, of course, just not set up for a holistic approach. Where else in the world is social prescribing actually being taken seriously by a mainstream healthcare system?
Definitely. And that's a great point. We'll come back to that because I have good news. I thought the same thing, but social prescribing actually has had some uptake in the United States. But you're right to point out that at first it began in the United Kingdom, which some folks know has a very different healthcare system than ours. Their healthcare system is national, which means taxpayers pay in, they all get the even care out. And it also means that they have a big national incentive, right, to make their healthcare work for everybody. And for folks who have friends in the UK or live there themselves, you might know that there have been serious issues with the UK's healthcare system, the NHS, recently. Issues of pressure, wait lists, not enough hospital beds, overcrowding at the emergency room. And what's happening actually is that patients who need clinical care, right, patients who might have cancer and need chemotherapy, are having a harder time getting a spot in healthcare because it's being taken by someone who might be struggling with a more non-medical issue. Actually, the data says that in the UK, 1 in 5 patients come to the doctor for social, non-medical reasons. My favorite story is about a man who would come to the emergency room every Friday night because he says, if I'm alone on Friday night, I don't know what I would do with myself. So when Right, which is heartbreaking. And of course, we want that man to get care, but we also don't want that man to take the spot of somebody who's really needs the clinical care of a doctor. So the UK invested in social prescribing at first as a way to tackle these non-medical issues because it was an incentive for them to be able to reduce the number of people going to healthcare for non-medical reasons. They even invested in a position called the link worker, which is a healthcare professional, sort of like an intermediary between the doctor and community, who really has time to get to know what the patient's interested in and what is available in the community for them.